Welcome back, everybody, to Val-You Based Care. I'm really excited today to have Dr. Justin Kline from the University of Chicago. I feel like the ability to collaborate with an academic partner, as myself being in the community, and have a really great relationship for a long time is extremely important to me. So I'm really thrilled, Justin, to have you. Thank you so much for taking time.
Yeah, it's a pleasure. We have
Yeah.
known each other for a while, so yeah, no, I'm grateful to be here with you.
Yeah, I was actually just thinking about how we've been working together since before COVID, I think.
Yeah,
And it's always been very easygoing and natural. Like, I feel like if I have any questions, I can always call you. I've never felt stressed out about it in any way. And you've always been extraordinarily helpful. And my patients always come back really happy. And I wanted to ask in terms of thinking about collaboration
mhm,
and really just communication in general, like what is masterful communication? Coming out of training, it wasn't really something like that we were necessarily focused on as fellows. We weren't necessarily thinking when I go out into practice, how am I going to be a really good colleague? But I felt like that's something that just came very naturally working with you. It's not easy at all, but seems very easy with you. And so I'm thinking about how whenever you're around fellows, is that something that they either ask you or you feel like there's a little bit of that in part of the training?
yeah. Well, first of all, thank you, Kim, for the kind words. I've really enjoyed working with you and your patients as well over these years, and I agree that when I first came out of fellowship training, I don't want to call it the business of medicine, but sort of the things you need to do to take care of patients outside of the actual medicine, was not something that I was, or at least that I remember being taught. The importance of communication. Matter of fact, I think historically academic institutions have done a pretty poor job of it, of communication with community partners. I think that's changing in general, but I really learned um, from a guy, Mike Bishop, who's our transplant cell therapy director. When he came, around 2012, 2013, I was pretty young at the time, I was young faculty. And, he told me, he said, every time that, you see a patient that's been referred, by somebody in that doc in the community, you know, um, shoot him a text to give him a phone call. It sort of cinches the relationship. You could convey like the most important information. Of course, they can read your note, but like maybe the one or two things that are most important, and you sort of establish a relationship with that person because you hear their voice and you're talking to them. It's different reading someone's note than picking up the phone and calling someone. And I've taken um, that teaching that he gave me some many years ago to heart. And so I make a point of basically calling every referring provider, and it's not only good for patients, right? It's good for my business, right? Because my business relies on community oncologists, right, who refer their patients. And if they don't feel like I'm communicating well, they're just going to send their patients somewhere else. And so it's a good practice from a business perspective, but more importantly, I think it's important to collaborate and taking care of patients because a lot of times they see me once and they come back to see you, Kim, and you deliver the therapy, you do all the work, and so I feel like it's the least I can do is to follow you and, kind of give you my thoughts and my recommendations and hear what you think as well.
Yeah, I really appreciate your very authentic and humble response. I think sometimes in the community, at least for speaking for myself, I get a little bit scared to talk to an academic partner because I feel like I'm going to say something stupid or outdated, or maybe it's going to feel like, there's a way that you like doing things and I'm clearly not doing it correctly. So it's always been so easy and you've been so approachable, and I really appreciate that. I think
No,
patients very much can feel that too. They feel like there's a better care when there's a partnership behind their care.
I I totally agree with you. And I think some of that anxiety that you mentioned around, calling folks that are very specialized in, say one type of cancer, like me, I happen to specialize in lymphoma. You're seeing, you know, anything that walks through the door, right? And so your knowledge is broader um, than mine, but probably you don't treat as much lymphoma as I do, and you probably don't spend as much time reading about lymphoma. That's all I read about. That's all I do, right? And so I don't know. I sort of, I think I realized that, like, like you can treat any kind of cancer. If I had to treat a person with, colorectal cancer, I wouldn't know what to do, right? So we all have our uses, I guess you could say, right? And so obviously, just from a human perspective, I just don't think it's productive. First of all, to sort of condescend or to openly disagree in front of a patient, and particularly with a particular treatment plan, even if it might not be the way I would have done it. That approach was a reasonable approach to take, and so that I think is really bad, and I know that happens. I think probably less so now than it did 20 years ago, but the patient wants to feel confident that the doctors that are taking care of her, him are on the same page, right? And I think that's important that you know, um, that they have a sense, as you said, that we're working together in a positive way, right? I'm not saying, oh, that Dr. Ku, I don't like this plan. I wouldn't have done it that way, right? Because that sows uh, lack of confidence. It sows mistrust, and it's not constructive in any way. So I completely avoid that. There's no use to it.
Yeah, and I really appreciate how you said that academic medicine could be better, but really, I mean, all of us could work together really well. I think that was very humble of you to say that, but I do think that in the community, we can also find ways to be better at communication too. I think figuring out how that works is always unique to each relationship, probably, but um, I do feel in this very fast-paced world that we're in where it's really hard to just exist in silos anymore. Like the public institutions and the private institutions really do have to work together. And I very much appreciate you bringing up the business part because it is the reality. I
Mhm.
think patients know that too, and it would really be a disservice to try to act like that's not important. But I think acknowledging that there's a relational part to also the business part and fitting in reality in a way that is helpful to everybody, like you're saying.
Yeah.
Eh, and it makes me feel better about challenging myself too, because sometimes I'll call you, like, not too long ago, I called you and I'm like, I knew that how I was going to sound, but I felt better knowing that I was going to get better care for my patient if I just asked you what you thought, even if it was going to reveal how little, how much rust has covered my knowledge. But I felt very okay doing that with you. I don't think I'll always have that kind of safety, but definitely felt so grateful. And I was even telling my patients, like, this is me phoning a friend.
Yeah.
So,
And I think they
um,
they like it too. When I see patients that you've referred, you know, um, often what I hear and often what I'll say is that, Dr. Ku is very easy to work with, very communicative. Some doctors are really hard, both in the academic setting, as you mentioned, and in the community to get a hold of, right? And we'll call about patients where you, hey, this person is doing well, whatever, just with little updates, or if you call about, with a question about a patient who I may never see, or may or may not ever see, that's okay too. That I feel like that's part of my job, and again, I'm happy to do it just because, I guess we go into this business hopefully to take care of people and to help each other out so we can help our patients. But also again, if you just from the business perspective, right? If if I take phone calls from folks who refer patients, and I might talk to them 2 or 3 times about patients that I might not ever see, you know, next time somebody wants a second opinion or they want their patient to have a second opinion or a consultation, they're going to call me. Right. And so it's good for business, and so, I'm happy to do it, I feel like we're all in it together, so to speak, not to be too utopian about it, but and then B, it's just simply good business practice, right? That's how I get referrals.
Yeah. Yeah, and it's I really very much appreciate because I'm always thinking like, oh, I'm not referring this patient, and so I'm probably truly calling in a favor. So it really does count a lot when you give your time like that.
Yeah.
So,
And it might be what, a few minutes, right? It's no big deal. Um, and yeah, I enjoy it. And, you know, I like doing what I do, and so if I can, hear about an interesting or tough case or something like, it's interesting to sort of think through it and say, oh yeah, I might do this and then that, or hey, there's no right or wrong here. I think either of the approaches that you're thinking about are reasonable, but it's just kind of fun to think through more challenging cases because those are the ones that you tend to call about, right? Not just you, but anyone, right?
sure, yeah, I do call about the super interesting cases though. Thank you.
You
The,
you tend
always
to
the
tend to
super
have a few of
ultra
them.
interesting ones.
Yeah, yeah, exactly. The straightforward ones, they're straightforward, and you do what you're gonna do, and you don't need um, that extra phone call, but, it's usually the ones that are a bit more challenging to those are the ones uh, that are a little bit stimulating to think about.
Yeah. And I also would say, and this will probably be a little more on the probably the touchy-feely side, but I find that when you role model like that and you have that kind of like a value base or an integrity, it really says a lot because was a time where am so swamped by phone calls. I'm kind of thinking, why would I do everything without like at least sorting out the reciprocity. And so there was a time where I was really protecting my time and thinking, like, is this going to make sense? But I have come full circle to appreciate that relationships are a lot more complicated than just like a math equation of I do this and they do that. That's more transaction.
Mhm.
And it took me a while to really appreciate that as part of growing up as a human being. And
Yeah.
I think having someone like you where I can reflect and go, well, Justin's always helping me out. So that's something to really cherish. It's not often or frequent that we work with colleagues where it's just always very consistent and reliable. And so
Yeah.
I really appreciate that you've been part of me becoming a better community side of the collaboration. So yeah.
Yeah, no, you've been great as well. There are, you know, I don't know. I guess I've never probably counted them up, but there are a number of folks that I have in the community that I've developed pretty strong relationships with over the years, and it's a mutual thing. Usually it's them sending me a patient to see or wanting to talk, but it's not infrequent that I have a person that I've met who, winds up in her hospital diagnosed with, in my case, again, lymphoma, but who lives in, I don't know, Peoria or something like that. And they wanted to be treated locally. And so sometimes I need to refer people out, back out to the community for treatment that I've initially, worked up. And so, I have, a decent sized network of folks, that who I know when I send that patient out, they're going to get good care. Right. And so, you're a shining example of that, but it's not always as you said, a one-way transaction, right? Sometimes I need a favor as well. I've got this patient, they can't, they're 85 years old, they can't drive 3.5 hours or whatever to get here, so I need to refer that person out to the community, and I want to know that the person that I'm sending them to is, uh, is what I consider a good doc, quote unquote.
Yeah, yeah, at least like fun to talk to.
Yeah. And I know them well. If there's issues along the way, that they know they can call me. And so these relationships, they take, like you said, they take time, they take effort. You know, I talk to folks, sometimes they'll be on call or something on the weekend, and they'll call about an aggressive lymphoma patient who's in, sort of pretty sick, hidden tumor lysis. I hate to talk business speak, but, or some other serious problem, and they'll, send me a text, and, you know, I, I call them back, and I know that in medicine and in the world these days, there's a lot about work-life balance, and I'm not saying that that's not important, because certainly it is, but I feel like in our profession, um, it, it the decisions we make, um, the things that we do are important, and I've always, for better or for worse, defined myself by my career, and so sometimes that comes first, even if it's on a Sunday morning, or Saturday evening, or on a holiday, I'm not ever unhappy about that, and it's something that's worth doing. We're lucky to do the job we do, um, whether it's Monday through Friday, 9 to 5, or otherwise.
Yeah, yeah. It's definitely a fine line of, I know we use these terms a lot. Probably sometimes it becomes overused and like a platitude, but things like I use this word like abundance a lot, or scarcity. And a lot of times I can tell someone carries themselves with abundance when they just always want to help, and they're always giving their time. And of course, there's times to rest, and there's boundaries, and of course there's limitations, and then it takes a lot as a person to then ask for help back. Be like, not in a, well, I did this for you, so you're gonna do it back, but like, well, I would really love, like, it would mean so much to me if you could help me. And then the other person really feels that flipping of, I had needed something, and then I fulfilled it, and now you need something, and I would love to help fulfill that for you too. It's very, I know it sounds very corny to say there's a lot of joy in collaborating, but that's definitely how I felt working with you.
Thank you.
Yeah.
Yeah, joy. I think, uh, it's, yeah, it does. I think the word for me would be, um, uh, I feel satisfied, when I've been able to do something good. I don't know, maybe it makes me feel a little bit better about myself, or I don't know. I think joy is a perfectly good term for it. But I feel good about myself when I've helped somebody else out who's in a pickle, because I've been in a pickle, and I phone a friend too. And I'm always grateful, to talk about a patient with one of my colleagues, even though we've both been doing this for a while now, but certainly we don't have all the answers all the time, right? And so, if you're in this business long enough, you're gonna come across scenarios which you've not seen, or you might not really have a good sense of what the next step is for a person that you're taking care of. And um, I'm grateful that I can call my colleagues on a Friday night or a Saturday morning, and talk about a patient, and they're always happy to do it. And when I'm able then to sort of repay that favor, if you said it, yeah, it, it, it it's a good thing.
Yeah. Yeah, and I noticed it's a very special trait, especially as I know that you have a lab too, and you study a lot of uh, immune related treatments. Like there's stem cell, there's CAR T,
Mhm.
and I actually thought it was pretty neat how on your lab website it just says people. I thought that was pretty cool. Like, there's no fancy little adage, it just says people. And I just thought, yeah, that's a really perfect way for you to do it. So,
I think in the sciences, as a maybe even more so than medicine, you know, um, it's important to give recognition to, the folks who are actually doing the work. Um, I guess at this point in my career, yes, I run a research lab, but I don't do experiments anymore, right? I write grants to try to get funding for the lab. I edit manuscripts. I try to come up with some new ideas, but, um, I look over data. But it's really the scientists in the lab who are driving projects. And so, I want to make sure that, that they're getting their due credit for all the hard work they put in. So, um, yeah, and that's pretty typical. I think basic scientists are better about many of them are better about that than we as clergymen, to be honest. But that's neither here nor there.
Yeah, and I was very curious about the fact that you wear so many hats because you are a great clinician. You work really well with collaborators across institutions, but you also are someone who writes grants and you train basic scientists and you translate that. And I know that there's a lot of question, or maybe not even question anymore, because I think there's outpatient CAR T in certain institutions and it's becoming more of a reality. Beyond that topic of medicine is a business, also a science, it seems like you're really well positioned to comment about how do you think about taking things like cellular therapies
Mhm.
and then putting that out in a way where the private and the public collaboration is thriving and helping with patients too. And it's such a complex model. I know there's probably a little bit of fear around it too because of how do we have the infrastructure in the community the same way that academic doctors do, and then how do we make it sustainable and viable long term so that all patients can get the access they need. It's very a very Rubik's cube. Like, how do you solve a problem like that? Maybe it's not really so solvable, but like, but I think about these questions, especially because you run a lab and you have this really great ability to articulate in so many roles that you play.
Thank you.
So
Yeah,
yeah.
I don't know that I have all the answers to those questions. I think there are some things that I have learned to be relatively well. You know, um, the logistics of medicine and the delivery of healthcare is not one of them. But I do recognize that, particularly around some of these complex cell therapies that you talk about, like CAR T cells, for example, probably the most prominent example, that, access is a major problem, particularly for folks who live in rural areas, for folks who are poor, um, for folks who are non-white. Access is a problem. It's been estimated that about roughly 1 in 3 people with aggressive lymphoma who are eligible for CAR T cell therapy, which can be a curative procedure, actually receive it, right? And that's not really changed that much since CAR T cells were approved in lymphoma in 2017. Um, and so access is a big problem, and one potential way to get around that would, as I think you alluded to, Kim, would be to deliver CAR T cell therapies and other cell therapies in the community. However, there are, obviously those procedures are expensive. There's a lot of red tape around them. They are associated with unique and sometimes severe side effects. And so I think certainly, and with good reason, there's some apprehension, you know. And so, I don't envision that CAR T cells are going to be given in the community at very small community practices where there's 1 or 2 docs. I think that's just not feasible. But certainly in larger practices, and I think as practices um, uh, in the community maybe are are hiring younger people now who are focused on more specific types of cancer. So you might have somebody in your larger practice who does breast cancer or lung cancer, or GI cancers, or blood cancers. I think that you hire these young folks. They've recently come out of their fellowship at an academic center. They've seen CAR T cell therapy. They know how to do it, and they're interested in starting up a program. Right. I think that's probably over time the best way to improve the access, because many of the CAR T cells that we deliver um, are pretty safe, particularly for lymphoma. For the most part, for myeloma, and they could. I do think that they could be done in the community. without any major issues. But you have to have like sort of a somebody to spearhead the the SOPs and the how are we going to do this at our hospital. And yeah, you have to have a big enough practice where you're going to be doing more than one a year, right? It's not rocket science, but it does, just like any type of therapy, it takes some experience to be able to do it relatively well and safely. But so I think that is one potential way to improve access. And then as you pointed out, the outpatient delivery of CAR T cells is another way. Um, but it's not just CAR T cells, right? It's all these other new therapies, new immunotherapies, bispecific antibodies, which, sort of I think are working their way in the community, but they also have some unique side effects. How do we improve access, to these newer therapies to patients who don't live, 5 minutes from a large, tertiary care center? I don't think it's ever going to be perfect, but I think we could do better.
Yeah, for sure. And I'm just curious nowadays. I say nowadays in a sense that I didn't get to train in a way where I got to actually give CAR-T
Hmm.
as a trainee. But I'm just curious what trainees experience when they go through training now. Is it like a whole year or like a 1 month rotation? How much exposure do they get managing these side effects?
Yeah, I think it probably depends on the center, but like CAR T cells are pretty standard at, I would guess, most every academic medical center. And so certainly fellows are gaining exposure here at U of C. Our CAR T cells, for whatever the condition they're being given for, are given on our transplant and cell therapy inpatient service, and the fellows do 1 to 2 months of that inpatient service, and so they're helping to take care of folks who are going through CAR T cells and experiencing some of the side effects. So I guess I wouldn't say that by the time they're done with their fellowship that they're experts, but they've been through it a few times. You know, at some centers they offer an extra year of training in transplant and cell therapy. So I think for folks who are interested in careers in those sort of subspecialties, that's a great way to gain extra clinical experience, but I don't think it's necessary, to be able to do it in the community at all. I do think that, the person needs to have some specialization in, say, you know, lymphoma and or myeloma or something like that, uh, in order to do it. And there needs to be enough people. So, right. So the same person isn't getting called every night when the patients have fevers or other side effect, right? So it's got to be a decent sized practice.
Hmm. Yeah, and how do you think about I feel like I'm making you answer all the world's questions right now. Like, well, how do you think about world peace and feeding everyone? And like, but things like integrating AI or telehealth, are these really going to make a mark on being able to expand access to your kind of very high level lab translation into community practice? Is that somewhat of a bridge? Maybe not prime time now, but could be helpful going
Yeah.
forward.
It's hard. I'm not a particularly technologically savvy person. Uh, but I do think, of course, I don't know that any of us was regularly doing like, telehealth or video health before the COVID-19 pandemic. But now I, I, I presume the same is true for you, but we've all become comfortable with it. Many of the new consults I see that these folks are, joining me from their bedroom at 7 o'clock in the morning. And so it's certainly convenient for them. I don't for new consultations, I don't love it, to be honest. It's a little bit harder to make a rapport with a person over, a video screen. That being said, to your point with regard to delivering, say, cell therapies, often what we'll do is once folks are, out of the hospital from their cell therapy procedure, they go back home. Again, let's say it's Peoria. We still see them frequently, but I'll tend to see them one week in person, and the next week we'll do a video. That way, they're only coming up, every other week. And that's been very convenient for people who we're seeing, they like it. And I think it's also reasonable. Now, as far as AI, I, I do think that it's going to likely have a major impact on translational medicine, biomarker discovery, um, things like that. I think it's gonna accelerate it. Now, what we I think have been not great at in the clinical realm um, is using the biomarkers that have been developed. Say, a biomarker that might predict benefit from a particular type of, say, immunotherapy, right? There's a really strong scientific paper or series of papers that suggest that this biomarker can really separate responders and non-responders to a particular immunotherapy. But the biomarker is not as straightforward as our pathologists, for example, are used to analyzing in the standard way they look at biopsy specimens, or the biomarker involves some mathematics or something like that we're not going to do in the clinic. We simply don't have time to, and I don't have the understanding anyway. But if these are things that AI can do and say, hey, the, the patient has these biomarkers and has a 10% chance of responding to this treatment, but has a 90% chance based on these biomarkers of responding to that treatment. I think that's somewhere where AI can maybe transform sort of translational medicine and personalized medicine. I do think that's going to be in the next few years a big step forward, or at least I hope it will be. And maybe I'll be out of business,
So,
at least in the lab.
well, I was gonna say, I mean, you can always come over here
Down
in
south.
Bloomington. Come join us in Bloomington.
I was just in Bloomington. I hate to get off topic for your podcast, but I was just there a couple of weekends ago. My youngest of four, she's on the high school dance team, and they had the state final, Illinois state final. So I was in Bloomington for a very cold, windy weekend at the end of January. Uh, it's a nice town. It's a nice area.
Yeah, yeah, we've got a couple community colleges, so I think it kind of surprises people when they come here, like, oh, it's
Yeah,
not small. It actually feels
yeah,
kind
it's
of
a
bigger.
good town. Or
Yeah,
you got Bloomington, you got Normal. I don't really know the difference between the two, but it seems like a nice place to live, to raise a family, et cetera, to work.
yeah, the Twin Cities, our
Yeah.
version of. But yeah, yeah, I remember you told me that your daughter was, we were gonna swap locations. So, but yeah, yeah, I very much appreciate just all of that, all we've experienced all these years. I'm always learning from you. I feel like as we try to figure out this huge change of technology, how we relate to information, I think immunotherapy of all types, cellular therapies, is such a challenge. So being able to work with you and just know that you're someone that I can reach out to, that just builds a feeling of community that extends even beyond community. Really makes me feel that that academic and private partnership that I look for. So wanted to end on parting words of how you feel for any trainees or new generation of healthcare providers, some compelling future and advice that you would give them, just thinking about going forward into medicine. What are
Yeah.
some things that you would leave them with?
Huh. Yeah. Wow. It's a deep thoughts. Okay. Um, yeah. I mean, again, as I said earlier, I, I, I feel that our profession is a calling. Um, you know, if you wanted to go into a profession where your goal was to make a lot of money, you certainly can do it in medicine, but there's a lot easier ways to do it. And so I think many of us, we see it as a calling. As I said, I've had a lot of personal satisfaction. Like I don't wake up in the morning and question why I do what I do, right? I feel blessed and lucky to do it. Um, it's meant everything to me. And again, in an era where I think folks are struggling with, you know, how to balance work and free time, you know, I never really think about it that much. You know, I have plenty of time to myself or time with my family, um, but I take my job seriously, and I encourage trainees to think about their job not as a um, as a job, but rather as a life spent doing something, right? And so that doesn't opt that sometimes that life spent doing something means, you know, you're on vacation and you're taking a phone call or whatever. And, you know, some people call that unhealthy. I think it's, you know, taking good care of people. I also just in the along the lines of relationship building, um, I do try to model that for the fellows that I work with in clinic, the importance of communicating with your colleagues, right, with your referring docs. Um, I I feel like a phone call is the best way to do it. Um, People use different ways to communicate, but I feel like, you know, I don't sign my note until I've made a phone call to the person. So that's how I know that I've done it. And so you know, I really do stress the importance of that. Again, not only from um, you know, from uh, a good communication strategy, a relationship building strategy, but also from a business perspective. Um, I think that's what I have to say about that. You know, this is a good job. You're lucky to do it. I try to instill that in young people. It's still a great job to do.
Yeah, I really appreciate you sharing your thoughts because I know it's probably for anyone who doesn't know you, it's easy to go, "Oh, okay." Like, but I know you, so I know what you're saying and you really mean it and it really comes from your heart. And I think there is uh that a little bit of like a generational or cultural different way of looking at things, probably across all institutions and disciplines, not just medicine.
Agreed.
And I don't know that it has to be so tense. Like I think there's something really amazing about the guard of doctors who did come from a time where it's like everything they did was for the profession.
Hmm.
And then they looked at it in a very different way from now where it's probably more this pendulum has swung to, well, you know, I'm off, so I'm totally off, and there's people covering, so don't ever talk to me ever. And and there's probably the reality is more in the middle.
For
There's
sure.
probably like oh, I'm happy to take a call, but I am kind of tired, so I'll invoke the coverage that I have. And probably a lot of people kind of sit in that middle, but I think being able to have this really great communication or connection where we can talk to each other about the way that we want to take care of patients. And I can tell that there's some differences, like our styles are somewhat a little bit different, but that's completely okay because our overall alignment is there, that we really just care about our work, our patients.
Yeah.
And you're right, there is a business, and you're right that there's some not so savory things like, looking into whether something's lucrative or not, even though, yes, we do need to think about care and access and equality and justice, but sometimes we can't get all that because of things like, unfortunately, like money.
Hmm.
But I appreciate how you go there. Like you talk about it and it's okay. That's the communication part.
Yeah.
And yeah, I do feel like there's a little bit of hesitancy to even talk about it in the younger generations. And so I appreciate how you've just brought that out, and it's very okay to chat about. And I do think when you call medicine a calling, that's something that I very much appreciate hearing from you, because you're right, there's other jobs out there and there's different ways to answer the call. Like for you, it looks very much like you're a scientist, but also you care very deeply about people. You care about the researchers as people, and you care about the patients, and you care about your colleagues. You're a very people person.
That's right.
And there are some who are more like, I'm going to be very analytical, and I like being that analyst, and everything I'm good at and my meaning is based on the data I produce.
Boop.
And then there's some people who are more entrepreneurial, and they like kind of putting their hands in a million different buckets. And we're all really coming from alignment of the same care, but just it looks very different.
Yeah.
And recognizing that through our ability to communicate and connect.
I think
So
that's like, it's one of the great um, aspects of medicine, right? You know, at its core, we take care of people, but there are so many different areas within the field that people can specialize, whether it's basic or translational science, or health economics, or clinical research, developing new therapies, you name it. Um, there's so many, or just being a doc, seeing patients. Uh, some people really excel at that, and so, you can, yeah, yeah, but we're all, despite our maybe specializations, for lack of a better term, hopefully, at least the ultimate goal, is to take good care of people and to work together to be so.
yeah, yeah. And you're very peaceful. Like I find you have this very accepting way, very like sometimes people can get on a soapbox and go, we're a doctor and we've got a calling. But you're very like, well, I mean, we all have our role, and we're all important for our own reasons, and it's not like we have to compare. And
Yeah.
so I very much appreciate that about you too, where I feel
Well,
like I
well,
can.
I would never, I would never, have the wherewithal to start a podcast. But we all have different talents, and I certainly recognize talents, and different talents in my colleagues, and I recognize many of them I don't have, so I can appreciate that. I think that's a good thing.
Well, thank you again for being so generous with your time. I'm excited about calling you tomorrow because I think you're seeing one of my patients. So,
All right.
yeah, y- yeah. So we'll keep on chatting and growing together. You'll see all the weird things that I do. And I doubt that your lab will ever go out of business.
Hopefully not.
And
No.
no, I've met some of your folks who research with you, and they're really brilliant. So I feel like that's a huge reflection of your life's work. Just those brilliant people. Uh,
I know how to recruit the smart ones. For sure. But yeah, thank you. Yeah, it's been a pleasure, Kim. Thank you for having me.
yeah, yeah. I just want to thank everybody in the audience too for joining us at Value Based Care, and hope to see you again soon.